Alright, so Ghanaian nurses and midwives are on strike nationwide. They started this by wearing red bands on their hands and on their heads, notifying the government that if their demands were not met on time, they were going to abandon the hospitals. They were going to abandon patients in the hospitals. They were not going to render their services to any patients in the hospitals. The government was not able to meet their demands, and for over a week now, they have been on strike. They have abandoned patients in the hospital to die, and they are on TikTok displaying their skills. The National Labour Commission declared their strike illegal, asking them to go back to the hospitals, but they did not agree.
The National Labour Commission on Thursday, 5th June 2025, summoned all stakeholders to an emergency meeting to address the matter. However, the GRNMA failed to attend the meeting. Consequently, the NLC was compelled to take legal steps to declare the strike illegal and called on the GRNMA to immediately call it off in line with law.
The Minister of Health pleaded with the nurses and the midwives to go back to work. He explained to them that should the government be able to meet their demands, whatever they are requesting, if the government is able to meet it, it is going to add an additional 2 billion Ghana cedis to the budget. It is going to cause a constraint. It is going to add more trouble to the struggling economy that the government is trying to revive. Please be patient. Go back and take care of the sick people so that when things get better a bit, then they can see how they can solve the situation. But the nurses and the midwives insist that they will not go back to work. Because of this strike, mortuary workers are raising an alarm of high death tolls. More people are dying as a result of this strike. In the hospitals, nurses, please go back to the hospitals. For the sake of your pledge, I don't know whether the midwives also recite the same thing, but this is the pledge of nurses. I solemnly pledge myself to the service of humanity and will endeavor to practice my profession with conscience and with dignity. I will maintain by all the means in my power to honor the noble traditions of my profession. The total health of my patients will be my first consideration. The total health of my patients will be my first consideration. As a nurse, please go back to the hospitals. You left patients in the hospitals. They are dying. They are struggling for their lives. For the sake of your pledge, go back and attend to them. The total health of your patients would be your first consideration. Please go back and consider them. Again, one may be wondering, why are the nurses on strike? Why are the midwives on strike? What is that demand that they want the government to fulfill?
In case you don't know the reason why we are on strike, we are not asking for too much from the government. And maybe can see how possible say nurse in the area no hospital Treska. Maybe not me really know. Me I really insurance what. Now say me say my to me I say you don't know. Oh my son me say okay. My main call yes special request now. Me call was on insurance. Me sure a music club ni a debe year drop mommy. Make a time, make a 236 something. Hey, like seriously. Ain't wait, baby. And you can see you see a buying no and take care of our medical bills. Is that one too much to ask? The
minister in charge of health is running out of ideas. He's running out of options. He do not know what to tell the nurses anymore to go back to their workplaces. He's asking all retired nurses to go back to the hospitals to give a helping hand for a short while they try to look into the situation to get a solution. The Minister of Health is asking all nurses, all retired nurses to go back to the hospitals. These old men and old women are tired, they are weak, some of them cannot bend down. Some of them will not be able to raise a sick man from his bed or her bed. How are they going to do this?
Opted to remain at post to help suffering patients and urge others to show similar fellow feeling and assist our ailing compatriots even as efforts are made to address their concerns.
The minority caucus in Parliament and the opposition party, NPP, who are the main cause of this whole issue, who are the backbone of this problem from the onset, also came out sharing their crocodile tears, as if they care so much about Ghanaians when they are the root cause of this whole issue in the beginning. These people also came out asking the nurses to go back to work, but as to whether they are saying this out of their heart, they are saying this from their heart, no one can tell. But from the look of things, these guys are the root cause of this whole issue of nurses going on strike today. There were those that took the shallow decision and they are affecting the people today. And today they seem to be caring so much about Ghanaians.
We are not here to justify the strike for them. We are here to plead with the nurses to understand that even if governments see the need to engage them, they should go with a good faith with Ghanaians at heart. Because getting all the money without the lives that we have lost brings no joy to anyone. So as minority, we are mindful of the fact that we are not stoking it up and asking them to prolong the strike. We are only asking them to be merciful as far as the tables are concerned, that when they go to sit, they must be merciful to see the need to be reasonable. We want to call a spade and just ask government to change their posturing.